Good morning, it's Brian. We are back again. Another phenomenal podcast. Remember, on these podcasts, we only bring in companies that we are investing in ourselves. We see tremendous potential. Actually, we see them going all the way to becoming a unicorn. And then whenever we do make these investments into companies, and then we bring it out for our fellow investors to show you why we have made the investment and where we think the company is going to, then there's always some other things in our minds as well as to why we like the company even more. And I'm going to share that with you as we go through this podcast. What you want to get from this podcast is, who's the company? What are they doing? Why is the market so absolutely epic? How fast are they going to grow? If you put your money into the company, how quickly are you going to be able to get your money back? What is the execution prowess of the entrepreneur that you're here in front of? What's going to happen with the company going forward with regards to the team? How much skill gapping is done within the team? And finally, how incredible is the market size and how much money are we going to have to raise to make sure that we capture that entire market? So we got a lot to go through in 30, 40 minutes. And first of all, I would like to introduce you to Muri, who we had the pleasure of investing in from Talamus Health. Hey, buddy.
Hey, thank you very much for having me.
Welcome, man. This is going to be awesome. It's awesome because, man, I am just loving Africa right now. I mean, I'm loving Africa is the gift that keeps on giving. Every entrepreneur we put money into who's hitting the African market is just killing it. And I'm not talking like a little bit better than India, a little bit better than the US. I'm talking like by a multiple of 4 or 5 times. What is happening in Africa right now? Because I'm not that smart. I'm just not, right? There's obviously something absolutely incredible and exponential that's going on.
Yeah, I mean, the African continent is going through a lot of demographic changes, right? First of all, from the socio-political point of view, I think African continent has been more stable than it's ever been for a long time. And for that reason, the economic landscape is a little more predictable than it is. But outside of that, it's a much bigger story, back-end story, is the demographic changes. The median age of on the African continent is 19.6 years old.
Wow.
Think about that for a second.
I feel old. Go on.
That's the median age. So you have people who are native technology users, as in it's not strange to them. You have people who, leverage mobile phone a lot for access to the internet. About up to 60 to 70% of internet access is via the mobile phone, which means pretty much everybody has the internet in their hands. And therefore, the ability to actually take products directly into the hands of people is much more elevated. And then if you look at also sort of this young age means that in the next 5, 10, 20 years, Africa is going to have one of the biggest labor force anywhere in the world, right? And increasingly having different kind of disposable income, not only locally within the local economy, but also internationally, because a lot of African people are beginning to work for international companies as well. What does that mean? Disposable income. And when people are technology savvy, they're young, they're connected to the rest of the world, and they have disposable income, they're going to expect a different kind of service level than their parents are. So this ain't your daddy's Africa anymore. Now, in the future, is going to be an Africa that is seeking to compete toe-to-toe with the rest of the world by leveraging technology. And this is where a lot of opportunities, and that's why you see that in the last 3-4 years, you have up to 6 unicorns that are focused on Africa, and then fintech space have been spurned. And in the other sectors, many companies are on their way to becoming unicorns as well. So there's no better time than this time to look at Africa when it comes to technology as an investment destination.
Yeah, and I look at healthcare as so interesting because really at the end of the day, the only thing any of us should be afraid of is the fact that our immortality doesn't quite bring us all the way, right? And so health is everything. Like money is useful. It's awesome. You get yourself a nice suit, maybe a nice decent pair of shoes. Maybe you can go and watch a movie. But at the end of the day, if I'm given the choice between having a really decent fintech app to make sure that I can get those things or not dying, I don't know, like call me old fashioned, but I'd rather live, right? So healthcare is so huge. My personal prediction is like if we go back 60 years or so ago and say, okay, maybe 80 years ago, like biggest companies in the world were banks, petroleum companies, maybe, and maybe some insurance companies, right? And then you go back like 40 years and we're saying, okay, it was like the IBMs, all big hardware companies, infrastructure of the internet. And then we go to today and they're all software, right? We got a couple of marketplaces thrown in there, but really it's all about the Microsofts and the Apples and everybody else is there. We fast forward 20 years, we're going to come to our senses. They're going to be healthcare companies.
I
Those
agree.
healthcare companies are the only ones that can save us. So whoever owns this now, investors, you have a choice. And look, we all like fintech and we all like our SaaS and those things, but we have a choice. We can try and grab onto times that have already passed and find the next Stripe, the next, forget it. Stripe exists, PayPal exists, crypto already exists. It's done. The horse is bolted, they've left. Or we can focus on what the next 20 years is going to bring. And that is going to be multi-trillion-dollar healthcare companies that keep us safe and healthy. Am I wrong?
Absolutely, you're right. I shouldn't say. I should say you're absolutely right. In the sense that one, obviously, you can't have a society thrive without a good healthcare system.
Yeah.
And all people's ability to predictably get good healthcare, right? Because obviously the economy relies on healthy people to run, right? So that's one. Number two is there is people will spend on healthcare if they can get value. It's just true. If people can get value, they will spend on healthcare. If there's access, they will spend on healthcare. If it's affordable, they will spend on healthcare. So you expect that. But even from a societal point of view, to take a step back, when they say a butterfly that flaps here can cause, a wave somewhere, we have to choose where we want that wave to be the nice surfing wave on California, or we want it to be a tsunami that destroys the town, right? The choices we make and where we invest in terms of healthcare has consequence, not only for the places we invest in those money in, but for our own lives. Like, the pandemic really points to a very simple fact. Something can happen in a small place far away and still affect your life in a tremendous way. So it's not just about that. The transformation and strengthening of healthcare systems around the world is extremely important, not only for those places, but also for us here in the United States and all over the world. But more importantly, it's just that healthcare is one of those things doesn't see a recession. A disease doesn't take time off. People get sick all the time. It's like it doesn't know what the market is up or down. It's just that people get sick and people need to get well. And so the key is, how do we make it available to them in a reasonable price? And that's the key. And companies that are able to do that are going to be major companies going forward, not only from investor return point of view, but also societal impact point of view.
And am I going too far here? Because I'm getting a bit carried away. We haven't even mentioned what you're doing yet, although it's all about this, right? But is this, I feel like this is the most important healthcare period in the last 50 years. I believe if there's waves, like 50, 70 years ago, it's like a really important wave because we went from like Stone Age into having stuff that was technologically friendly that just could help us too. But now I feel like we're at that next level right now. And it's almost like COVID was our great shake up to say, guys and gals, you got to do better. Just do better, okay? Because what we've been doing, we've been floating through for the last 40 years, and we've not really changed any paradigms. So you got a choice. You can have like a life-ending almost event, or you can try and fix it by solving the fact that it takes 10, 15 years to develop drugs. Solve it because make sure that you can actually get together as a community rather than fight against each other as individual companies. And I think we stepped up okay, actually. I think we stepped up okay to position ourselves in a place to actually be able to take advantage of the most important period in healthcare in the last 50 years. Yes or no?
Absolutely. Absolutely, for a couple of reasons. One, it's, going back to what I just said earlier, is this: it finally defined clearly the interconnectedness of public health, efforts around the world. You take the United States by itself. There was a lot of confusion around the public health mandates, the public health execution of public health decisions, because even within states, you live in California. Even within California, county to county, there were disagreements.
Oh, yeah.
Right? On how because for a long time, people had been comfortable in these silos of making decisions in silos and everything. Finally, when a pandemic like this shows up, the coordination of this case, the movement of data doesn't exist, communication between agencies doesn't exist. All of those things just were not in place. And it was such an eyesore because, you always could think the United States a bit on the advanced side, and it was a complete mess, And so this all brings back to the fact that, one, the leveraging of technology for these purposes, which for me begins with the individual, right? Being able to actually have a certain deep involvement of the patient as the center of the process, and leveraging the kind of what you learn about how people access and experience healthcare is going to determine a lot around behavioral health. Is going to determine what kind of policies we even generate and put together to make them more effective, right? Right now, we had none of that information. And therefore, we were really in our offices making up decisions that people just wasn't jiving with how people saw the world, or for that matter, how they saw their health. So I think what we have seen with this is that now it's looking around like, oh my God, we have a lot of work to do in terms of really digitization of healthcare, not only from a policy point of view or public health point of view, but from the individual point of view, right? Because people are struggling to say, oh, how do we know a patient who is in isolation with COVID is getting worse? Imagine if there was a system that existed where they're able to easily transmit that. We went behind the eight ball at that time, and we're having to build a lot of things. Now, as opposed to these little pieces of things that are happening, there needs to be platforms that are really able to aggregate the different aspects of this whole entire value chain. Not only from a means of communication and organization point of view, but a means of access for more people, right? If you look at the United States, certain groups really had COVID really hit them much harder than others. Well, if you talk about people who've taken care of them, it's no surprise. But for the rest of the country, it was a surprise because we never really made it easy for people to get access to healthcare. So when COVID happened, it was hard for them to get access to help as well. And therefore, they did worse overall. So if you think about it, this is a moment for us in history, not only in the United States, but in Africa, in so many places, to really change the game in the conversation about how people should experience healthcare in the first place. Because for a long time, the most important character in this whole play, the patient, has never been part of the conversation.
So I feel like this is even though it is the longest ever intro I've ever done into a company, I feel like this is the perfect segue. Like, you're leading beautifully into Talamus Health. You're like a Formula One driver coming around the curve at 180 miles an hour, right? Tell everybody listening, why am I so excited about what you're doing in Africa, and not just about Africa itself, but the new healthcare innovation that's going to come through, and Talamus Health, and how it is going to be such a monstrously important part of the solution?
Well, I'd like to bring the audience up to date on two things that may shock them, or maybe four, actually, that may shock them. The first one is that 38% of Africans every year will delay or forgo healthcare because issues around accessibility and cost. Think about that for a second. That is almost 4 out of every 10 Africans will delay or forgo healthcare every year because of issues around accessibility and cost.
Yeah, too much.
And hundreds of millions of people every year, right? Second, a study that was done showed that when the medication leaves, say, a manufacturer, by the time to get to the end user in Africa, they may be paying almost 7 times as much.
That is a broken supply chain right there.
Third, according to the World Health Organization, 1 in 5 medications in Africa is probably fake. So not only are you paying 7 times more to end insult to the injury, your chances are that 1 out of every 5 of those medications you just pay 7 times for is fake. And then more than anything else, in a resource-constrained place like Africa, a study by Brookings Institute pointed to that up to 4% of healthcare resources are also lost to inefficiency, pilfering, all sorts of things in the system. I think it's not hard to imagine how this is not sustainable for any society. And again, we cannot see of when we say society, I mean the world.
It also provides great
Because
opportunity.
going
Right?
forward, we cannot think of healthcare as healthcare in America anymore. We have to think about healthcare on a global level because we know healthcare systems, how they function in other places can directly affect our lives.
It's a huge problem. But by the way, it's also a huge opportunity. I would be more worried about the problem in a fully developed market where you're stuck with cronyism, right? The wonderful thing about Africa is everybody wants to fix it.
Yeah.
You know, except for the folks that there's small, tiny percentage of folks who benefit from that broken system. But the vast majority of people want to fix the system. And also the system is ready. There was a great talk over here by a guy called Bill Gross from Idea Labs, where he interviewed every single company that they'd ever invested in and looked at what was the reasons for success. And they found out that overwhelmingly it was timing. So it's not so much about the system being broken is a really important thing, but what's even more important is it is so ready for change that it's just like it's begging for it. So how did you come up with the genesis of the idea for Talamus Health? And then how will you directly interact with this?
Well, I'm a physician by background. I'm a neurosurgeon. So I do know the system in and out, how healthcare sort of works. I'm still in the United States, but I spend a fair share of time on the continent. I'm originally from Ghana and with Nigerian blood as well, so a combo. And I get calls from people all the time about, can you look at this for me? And my family has this. I mean, they don't really care that I'm a neurosurgeon. It could be any ailment because they don't know I'm a doctor. And you call me that. And I know that these issues persisted. But what really brought it to a head was an experience I had with my own mother, who suffered a stroke. I was getting my master's at the Kennedy School, and I get a call. So I step out of class and find out, and here we are, my mom has a stroke. And I'm trying to get help for her. She's in Ghana, and I couldn't. So at that time, finally, I'm like, okay, you know what? I've been thinking this thing has been going on for a while, but right now I really need to sit down and figure out what the hell is going on. And it became clear to me that there were many issues along the value chain. One is the issue of access and asymmetric information. A typical person who gets sick in Africa may have to trek for quite a while to get to the appropriate place to get care. And they may end up really spending time, talking hours at the hospital to be seen. So for someone who really depends on working every day to get care, they're probably going to forgo that part. So it's no wonder that the first point of care for healthcare in Africa is the pharmacy. A lot of people go, and when we say pharmacy, we have to qualify that because there's different tiers of pharmacy. There's community, what you call chemical sellers, where you can get a lot of fake medications, obviously. And there's actually a lot of people are not necessarily even qualified to really give you any kind of advice with regards to care. So we saw that part of the issue was the issue of accessibility. The other part of it, obviously, is what I mentioned earlier, issue of cost. It's just expensive. The medications, once even you get somebody to see you, it's expensive. And even trying to figure out where it's available is another issue. Some people may end up going 3, 4, 5 pharmacies before they actually find the medication they're looking for.
Wow.
So they don't have an ability to not only search and find out where the medication is available, they don't have the kind of price transparency to know, to shop around and say, you know what, I need to find a bargain so that I'm not going to poverty. About 11%. This same study by Brookings Institute, 11% of Africans will go into catastrophic poverty through healthcare spending every year. And none of that is driven by this issue of asymmetric information and the ability to see. All of these things are kind of interconnected to each other. So we wanted to build a platform that kind of address these issues because it has, unlike other industries, the healthcare is a connected ecosystem. And weakness in one really doesn't help the patient. You get the wrong diagnosis, right medication, you don't get better. You get the right diagnosis, wrong medication or fake medication, you don't get better. So if you really want to bring full value, which is the true north of bringing full healthcare to people that actually gives them the value they're looking for, you have to solve those problems in tandem with each other.
I
And
agree.
I ended up with Talamus.
And so, how did you do that? So, you recognize the size of the problem, you recognize the individual components of the problem, you
Yes.
recognize that it not only could it be solved, but it will be solved.
Yes.
And it's about getting into the market, getting in there with a very strong brand and with the right resources to make sure that you can be successful. So, tell me what you did and how you did it to put yourself in the strong position that you've got into today.
So, well, yeah, I had to find the right team to start. People who believe in that, and all the people who are part of the leadership team now have always also personally had these kind of healthcare challenges with their families. They've been in the healthcare space for a while, so they get it. The second one is to really take a step back and talk to customers and see what they need, right? And then go and build the product. So what we have currently is that one of the big issues on the continent is that if you really want to create an ecosystem and go digital, which is, again, leverage the phone that everybody has, you need to bring the different components digital as well. And the majority of places of the healthcare access points are still pen and paper. So we wanted to create something that allowed them to go digital in a very easy and affordable way. So we have an ERP and EHR system that we use to allow clinics to go digital. We have an inventory supply chain platform that allows pharmacies to go digital and connect directly to suppliers.
Fantastic.
That's the way that we use to cut down the middleman, which is where a lot of the cost of the medication is coming from. And also, we allow them to get authentic medication by connecting them directly to suppliers, right? And then kind of take away that issue from that end. And then we said, okay, who are the main characters here? Is the patient. So we allow the patient app, which is a mobile app, leveraging what is in everybody's hand, gives them the kind of ability to search for what they need. You want to find a dermatologist, you want to find an internal medicine doctor, you can actually find where appointments are available and how much it's going to cost you. So you can actually shop around and book the appointment and use mobile money to pay, as most people do, mobile money. You can search for medications, and our system will query all the inventories on our system and show you when the medications are available in stock and how much it's going to cost you. So you can shop around for a bargain. And through that, and of course, going digital, we built in the way that allows these clinics to be more efficient so they can serve more patients and even extend their care, their offerings by leveraging telemedicine to care for people at a distance. And by through this system and through some pilots we've done, we're able to show that we're able to increase the efficiency of some clinics all the way up to 67%.
Right.
It's huge, and decrease.
Huge.
And also for patients to save them as much as 30% in medication, which we still think is too low. We want to save them way more than that. But I think as our ecosystem matures and we have more pharmacies and there's more choice onto our platform, the market forces will push things down. And again, we're solving another problem for pharmacies, which is reducing the cost of procurement for them, which we believe eventually those savings will be passed on to their patients. So we're kind of leveraging free markets kind of principles and those kinds of things to try not only to bring safe care and more care to people, but affordable care to people.
And I'm going to save it for 10 or 15 minutes or so till the end before we talk about what the vision of what can be built here, because there are no boundaries to this. It becomes so huge. But before I get there, let's talk a little bit about the traction that you've encountered. And actually, before I get to the traction, this is all looking too easy for you so far. Like I'm feeling that you saw what needed to be fixed and you fixed it. Were there no hurdles, like monster, vicious, nasty Goliaths that stood in front of you and said, I'm going to destroy you and pummel you? Either technology issues with outside technology people, team issues as you're building teams and it's hard to get really lower cost people to come in and help you just because they care and that they love you. Like, talk to me about some of the pain.
Okay, so let's start with the team. I was very fortunate that I was able to get leaders in two main countries that really were in tune and purpose-driven like me. Of course, the rest of the team is sometimes challenging, hiring people, training people. Of course, you can't always afford the big people. And there are definitely, we still have some gaps. So everybody's doing everything right now. We're all wearing many hats. And my God, I always tell you this, Brian, my team deserves more than what they get. It's just they're doing everything, and so am I. I'm this and that and that, and we know that we need to move past that, obviously. But that's with every startup. That's how you start.
Of course.
So traction, you go out, you raise money, then you fill the
But you
gap.
could have had such an easy life. You're a neurosurgeon. You're the point like 0.00001. Like you're already giving enough. Like, why add this unbelievable burden of early stage startup on top of something that only enough? I literally know maybe 5 or 10 neurosurgeons. Like, I know lots of attorneys, by the way. I know lots of accountants. I know like a bunch of folks who are in recruitment and a bunch more, way too many in startup. But you already have achieved so much. Like, why go the extra length to adding on top of your already 16-hour day doing what you're doing?
Well, I mean, actually, it's funny. I've gone beyond that and shrunken my practice to spend more time doing this. I'm doing this because it matters. It matters. I don't come from a fancy, rich neighborhood. I come from the streets in Africa. And the people we are trying to solve this for are the people I grew up with. And whenever I go back to my neighborhood, I see it every day. I hear stories of somebody who's in their 40s and just dropped dead. Why? 40-year-olds just don't drop dead left and right.
No.
So we're doing it because it matters. We're doing it because Africans need to be able to live, and people all over the world. And by the way, this technology and this principle applies in Latin America and many other places. People need to be given a fair shot to live a full life. That's really the core of all of this.
Feels good, right?
People need to be given a fair shot. And part of giving people a fair shot is their ability to access healthcare in an affordable manner. Now, on the issue of what the obstacles are, I think it's one of the things you wanted to talk about.
Yeah.
Is obviously there's challenge, infrastructure challenges that comes with deploying a technology platform on the continent. And we've had to work through some of those, one being moving all of our stuff to a hybrid situation, online, offline situation, as opposed to online. Obviously, internet stability is what part of the reason we did that more than anything else. And I think there was a component of inertia, cultural inertia, that you see in healthcare everywhere. See, I think you alluded to this earlier, that even in the United States, that is supposed to be more advanced in a lot of ways, there's always cultural inertia in terms of technology when it comes to healthcare. It's just everything. It's just slower. The sales cycles are longer and all of those kinds of things. And it's no different over there. And there's something about medical culture that is just sometimes can be in a weird way, very risk averse. And I think the slow adoption of technology is really driven by some of that cultural component of healthcare, which is very universal in a lot of ways. Having said that, you said this also, you were right on that. The pandemic really got people thinking different. So we see a lot more inbound now. Our conversations are much easier now than they were prior to the pandemic. Now, of course, we went through the difficulty of the pandemic, and many clinics shut down and all those kinds of things, and many of them are beginning to show back up. So we dealt with that, the shutdown that happened, where just basically everything was shut down in Africa for months and all of that, and really couldn't do it. And some hospitals financially were in precarious positions because of that, and now has to really rebuild back up. But we're at the tail end of that challenge. But coming out of that, people are now like, you know what? I need to go digital, because if I had been digital during the pandemic, my life would have been much easier. I would have been able to access my patients. I would have been able to do telemedicine for people. I could have done this. I could have done that and that. And also say why a distributed system like what we're building is important. Being able to send medication directly to a pharmacy across the corner from the patient by being able to query that pharmacy inventory and know whether they have it in store or not is important, as opposed to just kind of the patient kind of having to figure it out on their own. So we built this with a lot of these ideas in mind that this is the post-pandemic reality. It means distributed healthcare delivery.
Yeah, but I would even add one extra term to it. I would say it is distributed proactive healthcare delivery,
absolutely.
because that's what the pandemic has done for us, right? It is actually, for the very first time, most of us, walked through life thinking, let's hope nothing bad happens. If something bad happens, then I will go to my doctor and my doctor will send me on the appropriate road. And really what you're saying to people is, look, come on, guys, you worked it out in the pandemic. You actually did something proactive to make sure that you had a better chance of survival. You no longer walked down the path of, well, if something happens, it was meant to happen. It wasn't meant to happen. Like, have a damn vaccine and you're going to be better. Or, do this or you're going to be better. Or be careful. Or wear a mask. Or stay away. Like, do something proactive and you will live longer and a healthier life. And what you're saying to the entire continent of Africa is the same principle applies beyond the pandemic. Don't you dare go back into your old behaviors again. This is a new world, a new beautiful world where you get to live longer and you get to be healthier and you get to be happier, but only if you follow this. So I want to finish it, and you can incorporate what you're going to say into this last piece, because this is the beautiful piece. This is when you take the present, you put it in a lovely box, you tie a bow on top of it, you look back and you're like, damn, that's a great gift I'm going to give someone. What is the big vision of where you're going to be in 5 to 10 years? What does Talamus look like inside the continent of Africa as far as a player and how it impacts all Africans?
We want to be in every country on the continent. We want to have tens of thousands of pharmacies on our platform, which means if you're a patient, doesn't matter what country you're on in Africa, you tap on your phone and you can find a pharmacy that has your medication with price transparency, allows you to bag it to be able to get the medication you need at the moment that you need it. We want you to be able to tap on your phone and find, no matter what, where a clinic is available and what time is available so that you can manage your time better. We want to eventually, within these 5 years, be able to bring you a way for you to mitigate your financial risk by being able to have affordable insurance that is good for you to be able to buy it. We want drug companies to finally not bring up medications they tested on, somebody in the Midwest of America and think it's good for Africans, but they'll be able to be in a very safe and regulated and structured manner, be able to do decentralized clinical trials so that the medication they bring to market in Africa is actually going to work for Africans. We imagine a world where we can predict epidemics by constantly being able to monitor in an anonymous and legal and ethical way the aggregation of symptoms and predict where epidemics are emerging and be able to deal with them from a public health perspective at the source before they become a problem that overwhelm our healthcare system.
Oh, I'm getting all chills. I love it. And by the way, we invested in this company. How awesome is that? Because it's all happening. Great leadership, great company, incredible region to be a part of, and just unbelievable vision for where the company is going to go in the future. For all investors that are looking to connect with you, how can they catch you?
My name is Muri Raifu. Email is Muri, Muri at talamushealth.com. Talamus being TALAM as in Mark, US.com. Muri at talamushealth.com.
We've got tons of diligence on the company before we reached the end, and we said, not only are there no challenges to us investing here, but we're so lucky to have even got an opportunity to get into the cap table. So for all of you investors, feel free to reach out about diligence. Feel free to reach out to Muri. This is a great company doing incredible things in a region whose time has come and is breaking through in a monster way. So it's just been a pleasure. It's so pleased I invested in you. Just keep doing the great work, and we're right here for you.
Invested in us. We've learned a lot from you guys, and we feel even more prepared now to be able to go out there and capture the market.
Thank you, man. Let's build a unicorn.